it might be morning, but for us it's evening in the UK. Warm welcome to you all. Let me just load up my slides, share my screen. That's great. Can we ask please to colleagues to mute the mics? So if you're not speaking, mute the mics so that there's no disruption. I'm now looking at my screen. I can't see you. Very warm welcome again. I'm Vishanth Weerakkody, Professor of Digital Governance and also Dean of Faculty of Management Law and Social Sciences. So just to give you a little bit of a background, University of Bradford and the School of Management in my faculty has been for many years engaged with the business community in Bradford, particularly locally, looking at trying to help the local community as part of our community engagement strategy. So we have a big passion for supporting the community, being a regional university and having a very much a civic focus. So the COVID crisis really provided us an opportunity to intensify some of our already activities that were already happening to support the small business community in Bradford, to see what sort of challenges they were facing as a result of COVID and how we as a university, as a management school in particular, could support some of these small businesses. So the research that we undertook started around, I would say, April, May, and it's still ongoing. In fact, today we had a big session with stakeholders, or a roundtable discussion with some of the stakeholders to discuss the initial findings, which I will present to you. The same findings were actually presented at 1 p.m. today to Bradford stakeholders, and I'm going to present the initial findings of an ongoing study that we have undertaken to understand the challenges that small businesses, micro-sized businesses face in Bradford as a result of COVID. So Bradford economy is largely made up of a large number of small businesses and also micro businesses and entrepreneurs. In fact, Bradford as a city in the north of the UK was identified as the city of having the biggest potential for entrepreneurs to start up business in 2018 nationally. So it's got plenty of scope for small business. And that large proportion of the economy is actually made up of small businesses, but COVID has really thrown the spanners on some of the small businesses, and the challenges that come with it were investigated as part of this research, with a view of coming up with some interventions as academics, as an institution, to support the SMEs. So the team that was involved in the research involves our Director of Business Engagement, Dr. David Spicer, Head of the School of Management, Professor Sanka Sivaraja, Dr. Kamran Maharoof, who's a lecturer in Supply Chain Analytics, and Dr. Samuel Adamoko, who is a specialist in entrepreneurship, and of course myself, looking at the policy side and how interventions can be developed from the perspective of government. So the research took two phases. The first phase was actually doing some focus groups with the business community, small business community, to talk to them and to understand some of the big challenges that they were facing as a result of COVID. And the second phase involved doing a survey. So we reached out to about 7,000 small businesses in the Bradford area. So two phases, and I'll talk to you about what we found during the initial findings from the two phases. We haven't really analyzed the data fully yet, but a high-level analysis of the data in the next couple of minutes. In the focus groups, we had about 65 participants. Out of these, about 14 were CEOs of small businesses. We had 36 small business firm owners in total. The 15 of them were female. We had 7 sector representatives, so service sectors, procurement sectors, manufacturing sectors, etc. And around 26 of these participants were Asian and minority communities. And we also had around 8 people who had management and other backgrounds. So 38 of the people, the small firms we interviewed had 10 employees or less, 12 between 11 and 50, and 8 over 50 employees. So they were kind of medium size, some of these. 30 in services, 11 social enterprise and charities, 10 retail and hospitality sectors, 4 construction and manufacturing, and 3 that were classified as others. So that was the focus groups. We had about 7 focus groups with the 65 different people. In each focus group, we had about 6 to 7 people, because obviously, as you will know, from a qualitative research perspective, ideal focus group should be between 5 and 10 people. So the survey which we undertook and is still ongoing at the moment, we have had 654 responses. That's around 10% response rate. Out of the respondents, around 39.9 were female, largely male, 60.1 were male. 93% was Asian, of South Asian descent. 3% were black, and 84% were white, and 17 classified as other. 53.4 were owners or CEOs of small businesses, and 46% was classified as other management from the 654 respondents that we've had. In terms of number of employees, as I said, there were no firms, but sorry, 10% of the firms had just 1 employee or the CEO. They were the only person in the organization, i.e. classified as micro or entrepreneurship firms. Between 1 to 10, there was about 40%, 11 to 50, 22%, and 50 plus about 25% of the survey respondents. And the sectors, as I said earlier, service, manufacturing, retail, construction, charity, and other sectors from the survey. So a little bit of the findings very quickly. So the impact of COVID, most felt that COVID has decreased demand for their business and of course increased operational challenges. And in terms of UK government support, many felt that COVID had a significant effect on their business, but actually 1 in 5 thought that it had a positive impact because it helped them to rethink the way they were doing business. And many felt that the government support that was provided in the UK through furlough schemes, for example, and employee support did really help the organizations, the small firms. It was a big shock for most of the firms, but it kind of taught them lessons about resilience and how to become more agile and adaptable. So those were the kind of high-level findings from the survey, which small firms indicated. Now, here is a table which actually gives you a snapshot of all of the different kinds of support, the main support mechanisms in Bradford and many other cities in the UK, actually. So we have the local councils, we have the Leeds Enterprise Partnership, and many cities have enterprise partnerships that support small businesses. You have the Chamber of Commerce, and of course, the Federation of Small Business. So 4 main mechanisms of support or institutions of support. And interestingly, if you look at the last 2 rows of the table, you will see that around 60% of the people were aware that there was a local council or a municipality, but they didn't really engage with them. So that's really worrying. And the Leeds Enterprise Partnership, again, 50% of the people knew that there was an enterprise partnership that would help them and they could seek help, but they did not bother to engage. Chamber of Commerce, it's the same story. They were aware of it, but they did not reach out for help. Federation of Small Business, similar situation. So as a city, the support mechanisms are in place, but small businesses rarely engaged with them, even in times of crisis. So that was a little bit worrying and interesting in terms of research findings. In terms of people and productivity, actually some felt that they had a positive impact on productivity because it helped them to rethink and to become more efficient. And they thought about home working, process improvement, using technology, enhanced commitment from employees who were retained in the firms, and of course, refocusing the priorities as well as streamlining activities. So really, it was not all bad in terms of COVID for the small business community, although there were broad, big challenges. Many felt that they were isolated, and talking about health and well-being of staff was a big issue. Redundancies were a big problem again because firms began to streamline some of the business operations and cutting costs. Therefore, redundancies were inevitable to happen. Firms also considered reducing office space and some moving operations completely online. So you can see the results are quite kind of mixed, rethinking the way small businesses were doing business. Some big negative impacts on the supply chain, of course, because many small businesses are reliant on a large supply chain that supplies raw materials, etc. So the supply chain challenges were beginning to affect most of the small businesses. But many felt that in the longer term, they would adapt and go back to a normal, and they feel that it was not too bad and they are resilient. Many felt that they needed to hold larger amounts of stock because of the unpredictability of the nature of where we are at the moment as well. So some supply chain related issues there. Lessons learned for the future. Many felt that it will take quite a while to really recover from COVID, but business models will be definitely altered. So they were not going to continue in the way that they were doing before. And technology, I think, played a huge role in that as well. In terms of post-COVID plans, plans for growth, for example, many felt that they were going to grow and looking to grow their business using innovation, using technology, but many also felt that managerial capabilities and skills was a real problem for most of the organizations. In terms of embracing technology, this was one of the big topics that were discussed actually, even in today's roundtable that we had with stakeholders. Organizations were beginning to get accelerated in terms of uptake of technology and increasingly using virtual as we are doing right now. Many have now adapted to the new world of the ways of doing business using virtual channels. However, relationships were identified as a huge problem. Mental health issues typically were also identified as one of the big issues. So, in summary, what were firms actually looking for? Many were looking for support and cash flow and appropriate financing from the different mechanisms, from the government, from networking, from Chamber of Commerce, etc. They also felt, many of the small firms also felt that communication was really important, consistency and confidence in what is being planned and communicated well, and that was a huge issue. They also talked about infrastructure support and upskilling in terms of digital transformation. And I think this is where some of the universities can play a role in supporting the small business community. And of course, strategic leadership development and support was considered as one of the other big challenges in terms of recovery planning, strategic planning, marketing strategies, forecasting. Again, many themes that universities can actually play a role in supporting. So what's the next step to close off my talk? Our next steps in terms of the research is to continue with our focus groups in terms of gathering more data. We are planning to offer some peer-to-peer workshops for the hardest hit areas and the hardest hit SMEs, co-creating with some of the stakeholders and providing peer-to-peer support. We are planning to develop a toolkit supporting the growth of small businesses. Some of this toolkit can be digitally oriented. Some of it is do with more training in terms of strategic planning, in terms of forecasting, in terms of developing digital marketing strategies, for example. So the big piece around training is planned by us as a university together with the stakeholders in terms of co-creating this toolkit. So digital skills I talked about already, and enhanced innovation support as a university, playing a role to support the SMEs. So being conscious that I've been given 10 minutes, I think I've hit over 2 minutes, but that's my talk. Thank you very much to everybody, and happy to take any questions in the panel, I guess, Hannah.
Thank you, Vishanth. And as Vishanth says, there'll be an opportunity to ask him questions about that research once all our panelists have presented. So we are now going to hear from Dr. Gillian Murray.
Hi, Hannah. After testing this, my presentation seems to have disappeared a little bit here right before my eyes. So let me... It's not going well today, is it?
Are you able to talk us through your presentation without sharing it?
Yeah, sure I am. Yeah, it seems to be loading up now, so I don't know. Let me know if you can see it, but I'll kick off actually. I know you're tight for time. Fantastic, what a cover that was. Can you see it now?
We can, yes, thank you.
All right, brilliant. So my presentation follows on very nicely from the earlier presentation, which is always nice at an event like this. And I'm going to focus on how universities can actually play a role in post-COVID-19 recovery. So now we've seen the research and what the companies need, how we can actually support that as universities, and particularly as technological universities. So I'm actually going to use our own Heriot-Watt's recovery prospectus as an example. Universities have a really critical role to play in driving forward our economies and also supporting our communities as we come out of the pandemic and we try to build back better. I'm sure, like me, you've all been absolutely overwhelmed by the passion our staff have given to support the pandemic efforts. And moving forward, this is something that we really need to harness, the energy of our staff and our resources and the thought leadership that they can bring to this challenge, and really leverage it to support an inclusive and sustainable recovery. So Heriot-Watt's recovery prospectus illustrates our commitment to this as an organisation and how we can help. The prospectus builds very much on our strategy 2025, which is entitled Shaping Tomorrow Together. And at the heart of that, we place collaboration, partnership and excelling commercialisation. And I think the most important thing in these times is our recovery prospectus positions the university to be agile and responsive and a real partner of choice moving forward. So within Heriot-Watt's recovery prospectus, we have made 4 main commitments, and these are really to reflect our collective powers and how we can support the economy. I'm sure many of the colleagues around our virtual table today will recognise these as activities that happen in their own university, and leveraging these to support all of the places in which we operate will be absolutely critical moving forward. So our first commitment really is to align our research to drive forward inclusive economic growth and support a green recovery. Our second commitment aligns very much to what we heard in the previous presentation in focusing our skills and expertise on the needs of the future and particularly the needs of our business partners. Our third commitment is really important at this time of challenge for young people, and as an organisation, myself and my senior management colleagues are committed to working as hard as we can to inspire our young people to be ambitious, resilient and enterprising. And our fourth commitment really is highly relevant to colleagues around the table today, in that we would like to engage our global networks to drive forward transformational recovery. I'm sure many of you will recognise these streams of activity in your own organisation. What's really important is the combination of these and the alignment of these to post-recovery, and that's where a university's transformational powers will come to play in the future. Obviously don't have time today to go into all of the elements of our recovery prospectus in detail, but it's really important at this time we're actually seen to back up our words with actions. So here we have a list of some of the key actions that we're driving forward across the university, and I won't list them all at the moment, but building on significant research income, around 20 to 30 million pounds that we already have. We're looking to build a global net zero network, connecting all our assets and investment across the globe to really support and transform the green recovery. Many around our portfolio and our skills committed to lifelong learning. But I wanted to mention the last one on this list. It's something that really has been accentuated by the pandemic, and our academic colleagues have been fantastic in supporting this. Is actually our research in our social sciences on focusing on a inclusive and a much fairer society as we recover. So I think we have to remember that as universities, we have skills across the STEM and across the social sciences that can really drive forward the recovery. A final key point from me, again, is how as universities we pull together our global connectivity to enable us to do this at scale, and all of us have these connections across the globe, and I think that's really, really important moving forward. And my final slide really is just to say that our recovery prospectus really is the start of the journey. It's nice to see how it aligns with the activities of colleagues earlier. And we're very open to new ideas and partnerships and collaboration. So I wanted to take this opportunity at the end of the presentation just to encourage delegates to discuss with me, to have a look at our recovery prospectus, which is on the web, and contact me if there's any interest or any areas of potential for future collaboration. So Hannah, I hope I have managed to get you back on track. That's my last slide.
That was fantastic. Thank you, Gillian.
I've no idea now how to get rid of it.
If you hover over the top of your presentation, there should be a box and a cross that says stop sharing.
I've got that. Thank you very much.
Really. I'm now going to pass on to Professor Dinakaran.
So, Vanakkam and hello everyone. It's my pleasure to meet all of you in the World Technology University Congress 2020. I would like to thank WTUC for organizing this global virtual Congress and also given me this opportunity to share my experience on how Hindustan persevered with research during COVID-19. I had an opportunity to talk about the products that are developed by Hindustan in WTUC webinar. Today, I'm here to share the challenges that we have faced and how we have tackled the bottlenecks and how we evolved the concept called design for emergency during this pandemic. So before proceeding my presentation, a brief introduction about our university. Hindustan Institute of Technology and Science is a renowned university in the South India, Tamil Nadu, which is the state of supremely rich in the Dravidian culture and heritage. And I am from Center for Automation and Robotics, and the focus of that center is robotics, automation, artificial intelligence research. And we have many funded projects with international and national agencies. And come to the research during COVID-19. When we have decided to continue our research, the question raised is whether to continue the routine research, or to carry out the research for dealing the pandemic. We have decided to respond for the emergency situation, which is the responsibility of any research center in the country. And the next is what is the driving force for us? The globe stopped revolving and there was zero mobility. So one side, the medical necessities are met by the global market, while other side, containment zone and boundaries mandate the sustainable global clusters to satisfy the day-to-day needs, which results in the mixed global and local business models. And this opens up the research and development in all the domains. How to achieve them? It cannot be started from the scratch, and the only way is to tune and orient the existing research towards the demands of the situation. And the idea is to use the robotic technologies to support the medical front line. There are 3 products developed by our center, and one is a tele-assistive robot to support the medical front line in the isolation wards. And the second one is the portable powered blower for PPEs, and the third one is the UV sterilizer for the hospital and the laundry applications. The second product we have developed, which is the aim of providing a portable, affordable, powered air circulation unit, which can be readily fitted with the PPEs. One important factor that we have considered is how these products developed for COVID-19 situation will survive in the market after COVID-19. Just changing the different applications after COVID-19 and then using them for the different applications. Just few seconds, I would like to show what is the product we have developed, and then I would like to share what are the challenges we have faced during the development of these products. This is the product called the Sevili and the tele-assistive robot, which is the Tamil word and the meaning is caretaker. The doctors are playing a crucial role in the battle against COVID-19. They are at high risk of exposure of viral transmission. The idea of this project to enable the remote consultation service, and the Sevili is capable of navigating to the isolation ward to deliver food, medication, and other necessities. Navigation is achieved through the simple joystick or mobile app through Wi-Fi. This is one of his first kind of the product, low-cost product available at 1,800 pounds that enables the hospital to implement these technologies, which is something uncommon in countries like India. So these are some of the things, and this is the testing that we have carried out in the state government hospital. Now I would like to share on what are the challenges we have faced. As stated by Mr. James Walker, there are 3 problems they faced throughout the globe. One is the resource, and another one is the time, and the next one is the mobility. In addition to this factors, we faced regulatory issues, procurement, workforce, industries are closed, and many logistical issues. After gaining the experience in the prototype development to tackle these issues, we have evolved a novel design approach which is designed for emergency. Design for emergency is a systematic approach to plot all the possible bottlenecks during the uncertain situations and to find the best alternative solutions without compromising the core functionality of the product. It is an approach with near zero product development time, limited materials, resources. Of course, psychological effects will have impact on the product that we should take care. We have devised different strategies to tackle these issues. We have tuned the ongoing projects to meet the current demands, and we have identified the dependencies and mapped them systematically. We have prepared the interdisciplinary team. We have believed in the modular design for easy scale-up. University has supported for the prototype developments, and parallelly we worked on the financial models, and we have received the funding from the industries to scale up. So this is the last one I would like to show to you. This is the architecture and the design for emergency approach that we have evolved during the prototype development, and we have followed during the scale up of the product. And this is the product that we have developed. Say for the example, I'm taking the robot. Many of the external factors are affecting the robot production. With these boundaries, we have defined the scope of the product, which is developing the teleservice robot for the consultation and delivery of essentials. We wanted to follow the design that we have arrived, but we did not find those components, relevant process equipments because of the situation. So we have identified the critical items in the product, for example, motors, actuators, based on their usage. In the design, we have assigned the wide range of specifications for each product. Weightage functions are defined for assigning the weightage for each and item. Here you are seeing materials, assembly, sensors, actuator, and many of the items. Say for example, actuator is given weightage 1 because it's very important component, and the next is the drive, which is given 0.9. In that way, based on the weightage, different models and different alternatives are generated. We have generated n number of alternatives for this design. With respect to the availability, a set of critical components are selected, and for the design, this is in the similar way, the process category is also selected. You can see here how the weights are assigned for each and everything, and how the alternatives are generated, and finally how we are arriving the weightage function. This provides a clear view on what are the obstacles and how to cross them effectively in the short time. Let us take the case where the complete scope of the product itself is changed. Initial design of the robot consists of the Wi-Fi communication, but unfortunately, the Wi-Fi network is not available in the government hospital where we deployed the robot. Then we tried with the LAN connection. We faced the issues in the video, audio delays, and navigation control is a very critical problem in the safety aspect. Then we have gone for the RF-based navigation for tackling this issue, and finally we solved that. That means that we have n number of alternatives, and we anticipated many problems and obstacles, and we find the way to move out from them. We have learned a new way of design called design for emergency, which has higher level of interdisciplinary interactions between the product functions, means, properties, and the availability. It helped us to avoid handling the unknown issues and obstacles, and provides a better idea to deal the alternative systems, alternative components in a very systematic, professional way. It gives a very great level of satisfaction to us. The contributions of our professors, scholars, students of mechatronics program are also very much commendable in this project. 2 teams of our students registered as a startup company at our university business incubator, and they are going to take forward the product to the next level. At last, I would like to thank our university for provided all the supports, and thanks the WTN once again for the opportunity given to share our experience and how we evolved the concept design for emergency. Thank you very much.
Thank you. That was really interesting. We're now going to hear from Dr. Dieter Bryniok.
Yes, thank you very much. Can you please upload my presentation? So I'm very sorry that you are not able to see me because my camera doesn't work, but I'm happy that you can hear me. And what I want to do is now to give you a quite different kind of presentation. I just want to tell you in the next 15 minutes about the effort we had to put into work again to reopen our laboratories to be able to provide research for the industry and for the public. So I will not talk about the industry, and I will not go into the details of our research, and I will talk about only the measures inside of our university. Can I have the next slide, please? First of all, I would like to explain the framework conditions we are working in. The Hamm-Lippstadt University of Applied Sciences has 2 equal locations in the federal state of North Rhine-Westphalia, but the Corona regulations were defined in the principles by the federal government in Berlin, but the state governments were responsible for the implementation regulations. And in our case, therefore, the state government of North Rhine-Westphalia was responsible for our regulations. The nationwide lockdown in Germany was decided on the 22nd of March, but our university had already been affected before that by the decisions of the state government. Next slide, please. And you see in this slide, on the 13th of March, the state government adopted a package of measures and postponed the start of lectures at North Rhine-Westphalian universities to the 20th April. 2 days later, on a Sunday, the 15th March, the state government decided on further measures, and on the 16th March, we had to implement these measurements of or these decisions of the state government. We started to close the university to the public and send our staff home to the home office, except for the building services and the administrative and technical staff, which were required for the university standby operation. And on the 18th, on Wednesday, all laboratories were closed. Next slide, please. So we only had 1 day to take the most important initial measures to keep the most important laboratories working. So we have equipment that must not be switched off for safety reasons, and also we have long-term experiments that must not be interrupted. And all these devices and experiments had to be registered, and these laboratories could not be shut down to a standby mode. That means the ventilation and temperature control was not shut down, and the laboratory managers continued to be authorized to enter the laboratory for inspection visits. And we had just 1 day to do this. And if you look at the square meters of laboratory areas in Hamm and in Lippstadt, you can imagine that was a lot of work. Next slide, please. The next thing was we wanted to get the laboratories running again as fast as possible to go on with our research projects for the industry and for the public. And we also had a digital semester, and so we wanted to shoot learning videos for our students. And so to get this laboratories reopened again, we formed a working group consisting of myself, the head of the organization and service department, the head of the building services, scientific staff council, and the experts for work safety. And this working group prepared guidelines for safety and hygienic aspects, and developed individual safety and hygiene measures for the individual laboratories. For each laboratory we wanted to reopen. Next slide, please. I will give you an overview over the most important measures and guidelines, but not for all of these guidelines. In the next slides, the persons with respiratory symptoms or fever were not allowed to enter the university. In all buildings of the university, we had to make sure that the safety distance of 1.5 meter was always recognized by all the people. During laboratory activities, also the 1.5 meter distance had to be maintained. Otherwise, the people have to use masks, and employees who are over 60 years old or have any pre-existing diseases like diabetes or Parkinson's disease or anything else, or are overweighted, do not have to work in the laboratory. Next slide, please. We have also made guidelines how to enter the buildings of our university. They should be present in the university only to the time which is necessary to the laboratory work. Paperwork should be done in the home office. We define different routes for individual laboratories to maintain a minimum distance of 1.5 meter. And for corridors in our university, which were less than 4 meters wide, we made arrangements. We made one route arrangements. And every person entering a campus of our university must register at a central registration office and state the attendance times and the room numbers and leave the mobile phone number. Next slide. For the individual laboratories, for each laboratory, we have additional safety and hygienic measures. So a laboratory could be entered only after a risk assessment and an individual hygienic and safety concept for the room has been completed. It was checked how many people may stay in the room at the maximum, so that the distance rule of 1.5 meters can be maintained. For each laboratory, the laboratory manager or the project manager of a research project must keep lists of names and addresses and telephone numbers of all laboratory users to be able to identify contact persons. And these lists have to be kept available in the laboratories. Next slide, please. And if more than the maximum permitted number of people should use the laboratory, a schedule must be drawn up. So we can avoid exceeding the maximum number of people at any time in the laboratory. The work in the laboratories may only be carried out between 8 a.m. and 6 p.m. And when a user of the laboratories enters the laboratory for the first time, the lab management or the project management must inform the user about all the hygienic regulations and the distance rules. And all these regulations were made according to the regulations of the state of North Rhine-Westphalia. Can I have the next, please? So we have 3 laboratories which we opened first because these laboratories were directly related to the corona pandemic or should serve for the public in the pandemic times. So the first laboratory was a chemical laboratory for the production of disinfectants, because virucidal disinfectants, which were reliably inactivate SARS-CoV-2 viruses, were very short in Germany at that time, and were traded to very high prices. Therefore, we decided to produce our disinfectants ourselves according to a WHO recipe, and provided this disinfectant to our building services and all the people who had to work on campus to keep on the standby modus and the standby mode of the university. Next slide. The second lab was a 3D printing laboratory for the production of protective masks. In this laboratories, some employees of the Hamm-Lippstadt University produced this protective mask for medical practices, for hospitals, and for emergency services. And the third laboratory was a biolab. And in this biolab, we developed the SARS-CoV-2 qPCR test. The reason was the Ministry of Health and the Ministry of Science of North Rhine-Westphalia launched a survey at all universities in the state of North Rhine-Westphalia to identify laboratories which are capable of performing this corona diagnostics with qPCR. And our university offered this help, and the scientists of our university immediately started to develop the qPCR test according to the specifications of the Charité in Berlin and the Robert Koch Institute. Finally, I would like to give you the current state now in October 2020. And I want to mention too that in the winter semester we have a so-called hybrid semester. This means we have both digital teaching and also classroom teaching and practical courses in our laboratories. And so overall, we permitted the access for 51 staff persons for each single persons separately. In Hamm, for 25 research laboratories, for 30 teaching laboratories for the production of learning videos, and 23 laboratories for the practical courses in the winter semester. In Lippstadt, it were 49 staff persons in 43 research laboratories, 29 teaching laboratories, and 15 laboratories for practical courses. This was my final slide. I thank you very much for your attention, and I'd be happy to answer any questions after the last presentation, or also you can send me questions via email to me. Thank you very much.
Thank you very much, Dieter. And finally, we'll hear from Associate Professor Norhayati Abdullah.
Thank you, Hannah. I'll try and share my slide now. Okay. And it's come in. Just 1 second. So I am Norhayati Abdullah from Universiti Teknologi Malaysia, and we are almost 1 a.m. At the moment as we speak in Kuala Lumpur. Oops. I hope I don't get the wrong slide. Just 1 second. Okay, so the slides is basically uploading from my laptop. Just 1 second. So I basically work at UTM International, Universiti Teknologi Malaysia International Office in Kuala Lumpur campus. UTM has 2 campuses. One is located down south in Johor Bahru, and the cluster campus is in Kuala Lumpur, about, I think, 5-10 minutes from the Twin Towers. And then today I'm very happy to share what UTM has been doing in terms of the COVID-19 pandemic, and then what kind of initiative and research that we have been doing throughout the testing times. And it is so nice to see the sharing from all of the speakers from other universities today. Right. So first and foremost, I would like to mention just a little bit how I met wastewater and how I came about to talk about this topic tonight. So I'll be sharing some of the study that we did for the Ministry of Environment and Water on testing coronavirus in wastewater as bioindicator for a pandemic. So I began my PhD I obtained my PhD about 10 years ago. And then I used to work with wastewater via collaborative work between UTM and Newcastle universities and various universities. And then it has been very interesting that for the past 10 years, I have been involved in various wastewater projects. And then the control of COVID-19 in sewerage system as an early indicator of outbreak in Malaysia is a project under the auspices of the ministry. And we work with our National Hydraulic Center, NAHRIM, UTM, and National Sewerage Company Indah Water Consortium Sdn Bhd, National Water Services Commission, and then we seek advice from 2 international universities, which is Delft University of Technology and Newcastle University. So as we know, coronavirus has been reported to be able to survive for long periods outside its host organism, mediating human-to-human transfer. And then it has been previously detected positively in stool samples of infected patients. And then this research has been conducted in various countries, mainly in Holland. And then based on Malaysia's scenario, we wish to look at establishing a COVID-19 protocol as bioindicator in localized sewerage zone. For your information, we in Malaysia will be going through another phase of movement control order beginning tomorrow, whereby we have resumed working from the office for a couple of months since end of July. But we have a very sharp spike of case rise in some states in the country. And we have had the highest number reaching 500, 600 cases per day, and then with fatalities each day. So the government has imposed yet another wave of working from home mode for everyone in affected states starting from tomorrow until the 27th of October. So basically today is my last day in the office, and tomorrow I'll be working from home all over again for the next 14 days. So, okay, I'll move to the, okay, so this is where we did our study. Klang Valley attributed to more than 40% of the peninsular COVID-19 statistics based on information as of March, and as well as of now, we have had the highest number of cases in the third wave of COVID-19 in Malaysia. We have actually three hospitals that focusing on providing treatment for COVID-19 patients. Hospital Kuala Lumpur, which is very nearby to UTM, as well as Universiti Malaya Medical Center. And then we have another hospital, Sungai Buloh Hospital, which is an infectious disease hospital located about 30 minutes drive from UTM. And these hospitals are served by the regional sewerage treatment plants at Pantai Dalam, located in Kuala Lumpur. And then it serves about 1.4 million population equivalent, which we feel that it is a good representative of the population in Klang Valley, which is highly affected at the moment with the COVID-19 cases. Just to show you some idea where we did our sample. So this is where we were with the team from the National Sewerage Company, because the sampling points is basically under their jurisdiction and care for the operation part. Okay, so it's a very big treatment plan with a range of sewerage networks there. And then we did a sample at 7 sampling points. Right. And these are the team members who did the sampling for us during the peak time. And I think it's about time that we did another sampling within the next couple of weeks or days due to the spike in the number of cases yet again in Malaysia in some of the states. So it has been very challenging, and it has been very interesting as well for us, the research team, looking at the various results that we have thus far received. Unfortunately, some of the results are embargoed, and then I can't potentially share with you tonight. But what we can say is we have detection of coronavirus in the wastewater samples that we had. And then obviously, similarly to other countries, what we're doing is some molecular analysis to see if we do have the RNA positive for coronavirus, in which we had. And then what we will do about the results is that to suggest to the government how might we improve operations at the sewage treatment plants, and how might we use it as bioindicator for pandemic rises. As for UTM, we have a magazine, UTM Nexus, which is accessible via the link. And then in this magazine, we share what UTM has been doing in terms of COVID-19 initiative. It's interesting to see what your universities are doing in terms of encouraging research as university body, sharing information with the public. What is it that we're doing to help the public cope in times of difficulties like this? So some of the initiatives are, we provided intubation aerosol box, and then providing face shield, hand sanitizer, portable ventilator system for hospitals. Some of our researchers created a disinfectant chamber and isolation pod for patients. And then how might we check temperature measurement using deep learning? And then obviously we are embarking upon and actively doing e-community social support framework. And then some of our researchers launch autonomous UV disinfection robot for hospital usage, and then some of the prescriptive action and prediction tool for the virus, for the disease. So it's all can be accessed via the link. And then there are so many news that feature not only UTM, but also initiatives from other universities in Malaysia. So some of the example whereby we have our Malaysia-Japan International Institute of Teknologi providing medical support tools for preventing infection. They develop medical support tools for dealing with the coronavirus with our Japan partners from JICA, Japan International Cooperation Agency. And then we use the CNC machine to produce face shield design at our lab, which has been developed together with our Japanese professors at the institute. And then another example is that DF Automation and Robotics Sendirian Berhad, DF, jointly developed a delivery robot system with Hospital Chancellor Tuanku Mukhriz. So this is also available online, where we can further read about what is it that has been done by the researchers from UTM under the with cooperation with the company, and the company is led by our UTM professor as well. Apart from that, students' activities, international students' activities are all ongoing, whereby students are largely involved in online learning. And starting next week, I think we are having our orientation program. All will be done online for incoming new students. And then all classes will be done online as well until 31st of December 2020. And then on international side and mobility programs, we still welcome inbound mobility, whereby some of our Japanese students will be joining classes for about 20 weeks as part of their inbound mobility program. So all of these activities are still ongoing and oncoming, and then not only for UTM, but also for other public universities in Malaysia and also private universities in Malaysia. There are a lot that is being done by the universities to support the country in terms of providing the best that we can when it comes to classes and as well as research. I think that's all for tonight, and just sharing with you what we did last time with the Ambassador of Japan in Malaysia on another platform of Alliance. So all of the alliances are still operating and doing activities online. And then UTM is continuing the professional networking and then maintaining the relationship with our stakeholders and partners all over the world via the online system, just like WTUN is doing tonight. So happy to share this. Thank you very much.
Thank you. And thank you to all our panelists this evening. It's been really interesting to hear such a diverse range of approaches to research during COVID-19. And now it's your turn to ask our panelists questions. So just to remind you, you can submit a question using the chat function, or you can raise your hand and we'll call upon you to ask your question. If you are going to ask your question, just please remember that you're on mute. So you need to remember to unmute yourself so that we can hear you. Has anybody got a question? Gareth.
Thanks very much. I've got two questions actually. The first one to Professor Weerakkody around the work he was doing in Bradford and the support for SMEs and startup companies. I was just wondering how internationally believes that would be if you were to do the survey beyond Bradford and out with the UK, whether there'd be similar outcomes from it and whether it's at a scalable and international level. And while if I've got my microphone on, if I could just also ask Dr. Abdullah about the tracking of COVID-19 in the sewer systems, whether the principal use is to try and track the spread of the virus within Kuala Lumpur for lockdown purposes, or whether it's to sort of stop the spread of the virus and control it within the sewer system. So if you could indulge me with these two questions, that would be good. Thank you.
Thank you, Peter. Yeah, it's a very interesting question, actually. Bradford is a very unique place in that, as I said when I started my presentation, a large proportion of the economy is made up of small to medium-sized businesses, and it's a place where entrepreneurs kind of thrive. But also there are lots of ethnic minority businesses, particularly of South Asian descent. And it seems to me that it's quite early to make a judgment because we are analyzing the data, but all indications are that the results are quite unique in that if you look at the support system across the UK, and I guess internationally is the same. In cities, there are support systems that provide support to businesses through the banking systems, through Chamber of Commerce, through the municipalities, etc. The support systems are very similar in most places, but interestingly, many of the small business communities did not engage with the support systems, and that's a little bit worrying because they were not reaching out to the help. So it's not that the help is not there, and it's kind of baffles us at the moment to see why this is, and they were almost kind of suffering on their own, and that's quite strange. So I don't think that is the case nationally. If you look at big cities like Leeds, Manchester, London, the businesses are more proactive in terms of how they engage. One of the reasons, I guess, for this is that from a technology perspective, the use of digital technologies was quite in a very early stage for many of these SMEs, and they were very much family-oriented, family business-oriented. So you're looking at small businesses that were dealing with the beauty industry, hairdressers, restaurants, and very few kind of involved in the high-tech manufacturing area. So I guess that's one of the reasons that the nature of the business probably does not represent the national and international trend. So we kind of need to dig in a little bit more because the research was actually initiated because of some of the concerns that the BAME community, the South Asian and the ethnic minority communities had regarding the support, the challenges that they face, not being able to grow and sustain, for example, even before COVID. That was a big challenge that we were facing in Bradford as a city. So businesses not growing, they start up the business and after a few years they disband and probably go and do something else, most of the business owners. So this was one of the motivations, and it's quite, I can't kind of fully answer your question, but all indications are that it's quite unique, this case, where we are a city in the north of the UK with a large population of Asian businesses, and there were cultural, there were social issues that probably prevented businesses from engaging in the normal fashion that you would see in other big cities. That's all I can kind of say at the moment, and this is quite shared between some of the big stakeholders as well. So when we speak to the Chamber of Commerce, when we speak to the Council, I can't see anything wrong with the infrastructure, the support system. It's just that the way how the dynamics happen between the small business communities, because large proportion of the community, small business communities are, as I said, from ethnic minority communities who start up the businesses. So that's what we see at the moment. I don't think it is representative nationally or internationally.
Thank you, Vishanth.
Hi. Yeah, if I thank you, Mr. Gareth, for the question, and if I may just briefly respond to the question related to the observation of coronavirus in wastewater and how might it impact public health. Basically, UTM embarked upon this research because we have a group of wastewater researchers, and then the ministries are interested in terms of, they would like to know how might we use wastewater-based epidemiology for informing the public that, hey, we have coronavirus in the wastewater, and then how might the first one, the STP operations may be improved based on this information, and number two, how might we tackle important community public health questions that may arise in times of pandemic. And then the investigation and surveillance of bioindicators in wastewater may be used to inform public of how might we react to community health and behavior towards spreading of infectious disease. It's very challenging because it takes time to tell whether or not we have, well, we have all kinds of viruses, but COVID-19 virus is very unique and special in terms of its characteristics. And then because our sewerage treatment plants receive so much wastewater for to identify whether or not we have the presence of specific virus in wastewater takes time. And then having an infectious disease hospital in Kuala Lumpur that specifies onto looking treatments of patients with so many different types of infectious disease, but with a designated STP dedicated to receiving wastewater from this particular hospital do help us to further narrow our study. For the moment, we started the study last March, but we didn't manage to do any testing until about July, because we do go for sampling, but then the sample has been kept. But then the testing could only be done from July until recent. So there are the results on our side, on Malaysia's side, is still scarce, but we're very positive. This is the positive results that we wish to have in terms of describing COVID-19 in wastewater. So thank you. I hope that answers your question.
Thank you. We are running out of time, but we may be able to fit one or two questions in with quick answers if anybody has any questions. Well, very quiet. Gareth.
Sorry, I don't want to drag it out, but I did have another one. So the COVID-19 crisis has had an impact on universities probably as much as an industry. So I think we're all struggling for funding. So I was just interested to hear from Dr. Murray that you know, her recovery prospectus makes some really quite big commitments on the part of Heriot-Watt University. So how can the university afford to deliver against these when it's in such a you know, when the income to universities is also stretched?
Thanks, Gary. I think you're right. It is challenging times for universities. We are an organisation ourselves who have to navigate this area. But there's never been a time when there is more funding into research and research that would be driven into solving these major challenges like COVID, like climate change, like green recovery. So the opportunity is there, and governments will be looking across the globe to support driving the economy. And one area that's key in that is particularly investing in infrastructure. So, you know, universities with their lab facilities, with their, you know, state-of-the-art infrastructure can use that to start to drive forward the solutions of the future. So it's a challenge, but I actually believe it's a major opportunity, and important that we leverage as much the funding that's available and align it to that challenge.
Thank you. So unless there's any other questions, I will say thank you again to all our panelists this evening for delivering really, really interesting and varied presentations. And thank you everybody else for joining. Coming up next, today in the Congress is the showcase session. And if I don't see you again during the Congress, I hope you enjoy it. Thank you very much, everybody. And good evening.
Thank you. Bye.
Thank
Bye,
you, everybody. Have a nice and good night.
Bye.
Thank you.
Thank you for the presenters.